certifiably crazy. A fellow Chicago Democrat once called the governor a madman and insane. A February Chicago Magazine profile quoted people who knew the governor saying he was sociopathic. Others said it's a psychopathic personality disorder. Well, then there's the Chicago psychologists who think Hot Rod's perpetually perfect blow-dry hints at a narcissistic personality disorder. Quote, "It's part of the grandiosity. They're not going to be able to punish me. I'm above the law. I'm smarter. I will outfox them." So is there something clinically wrong with the governor who once boasted about his testicular virility after a public falling out with a father-in-law who ushered him into politics? Dr. Daniela Schreier is a clinical and forensic psychologist and assistant professor at the Chicago School of Professional Psychology. And Dr. Larry Grimm is an emeritus associate professor of psychology and director of graduate studies at the University of Illinois, Chicago. Dr. Schreier, it's one thing to be sneaky about your corruption. What do you make of Blagojevich openly stating on conference calls that lasted 2 hours that he wants to cash in?
Well, I think it's just another sign. I see that on several other interviews that he has kind of a white-collar psychopath's mind, and I think it just fits in with actually the stereotypes that we pointed out. And I wanted to make also sure, thanks for having me on the show, first of all, that we're not talking about the governor. I never had the chance to speak to the governor or to assess him. We're talking just about the behaviors and actually what we hear about in the media about him.
Oh, no worries. We're not wanting to suggest that you or Dr. Grimm have actually conducted any sort of assessment in person. But Dr. Grimm, Blagojevich used the F word all the time. Here is Prosecutor Patrick Fitzgerald recounting some of the conversations Fitzgerald did it in a family-friendly manner. Watch.
In the governor's words, quote, "Fire all those bleeping people. Get them the bleep out of there. It's a bleeping valuable thing. I've got this thing, and it's bleeping golden. And I'm just not giving it up for bleeping nothing." Those are his words, not our characterization, other than with regard to the bleep.
Dr. Grimm, what do you make of the profanity and how it fits in with his psychological profile?
Well, I don't think that much can be made about cursing and any kind of psychiatric diagnosis. There are people who prefer to use that kind of language and others who don't. It's really more of a moral issue. And some people who are very aggressive in their lifestyles tend to swear more, but I wouldn't make too much out of that.
All right, can we make anything of yesterday? In the midst of all of these people ignoring and abandoning Governor Blagojevich, there he was, the cameras captured him, and he sort of waved as if he was at some parade. No bothers in the world. Can we make anything of that?
Yes, I think we can. I think he's at a stage now where he is underestimating the gravitas of the situation. He's probably in some level of denial, and it certainly represents an extreme form of arrogance, which is very characteristic of his behavior throughout this whole process.
Well, and on that arrogance, let's play the soundbite of Governor Blagojevich from Monday when he was hanging out with some city workers who were, and he was trying to show some solidarity with these factory workers. Watch this.
There's nothing but sunshine hanging over me. Let me answer that. Your question is, and by the way, I should say, if anybody wants to tape my conversations, go right ahead. Feel free to do it. I appreciate anybody who wants to tape me openly and notoriously, and those who feel like they want to sneakily and wear taping devices. I would remind them that it kind of smells like Nixon and Watergate. But I don't care whether you tape me privately or publicly. I can tell you that whatever I say is always lawful, and the things I'm interested in doing are always lawful.
Daniela Schreier, what do you make of that sense of confidence that everything he's doing is lawful when all these conversations and all these witnesses presumably would say the exact contrary thing?
Well, I think actually it plays exactly in the profile that we pointed out. For example, a sense of invulnerability. I am out there, no one can get me. And maybe this is what upset the public so much that people yesterday went out and said, oh, there must be something wrong with him. Because it's kind of such a violation of social norms, but his calmness, his lack of anxiety, and actually the compulsive saying, I didn't do anything wrong. I guess this is why people came up with, oh my God, there must be something mentally wrong with the person, but it really underlines only the profile that we pointed out before.
Well, are we crazy for suggesting that he's crazy?
Well, I think what we are very leniently saying, we are all crazy, we all have personality traits, we have all things going on with us, but this does not fit into, like, is he mentally ill? He might meet some actually personality traits, some of the symptoms, but he does not meet a full-blown diagnosis, at least what we know by now. And certainly this does not help him actually in the court of law to be qualified as mentally ill or not guilty due to unfitness. So yeah, no, it would not be.
Well, speaking of full-blown, that reminds me of his full-blown hair. And Dr. Grimm, this idea that because of the way he coiffs his hair, that signals some sense of overconfidence. Is there anything to that?
No, there's nothing to that. I don't think that what we should do is pick out tiny little behaviors and blow them out of proportion into a psychiatric diagnosis. What you have to do when you characterize somebody, especially if you're going to use a diagnostic term, is you have to look at a broad pattern of behaviors, because personality disorders are defined by a confluence of a number of traits that hang together. So it's really a mistake to just pick out one tiny little thing and run with that. I mean, we certainly have enough evidence.
Sure enough, sure. But as far as disorders, at least from a political perspective, when you look at a political team, it certainly seems like a disorder how isolated he was, say, I don't know, from Lieutenant Governor. Here's Lieutenant Governor describing that. Watch.
I haven't spoken to the governor really since the summer of 2007. I led an effort to try and put recall on the ballot as a constitutional amendment in Illinois. It has widespread support.
Doesn't that seem strange to you, the lieutenant governor not speaking to the governor? That's certainly not the way business is normally done.
Well, I tried to. I think lots of other public officials tried to. The governor's very isolated. That's one of the problems right now. But hopefully, upon reflection, the governor will decide that the interests of the common good and the people of Illinois require that he step aside and resign from office.
Dr. Grimm, an isolated man who has not budged despite all the criticism, who thought he could get away with this, who didn't think anything wrong about going on a conference call with dozens of people and saying he wanted cash for the Senate seat. Is this somebody who is psychologically fit to continue governing?
I don't believe that he is psychologically fit because his judgment is so poor and that it's a complete breakdown in leadership. And you can't be a leader unless you have people who are willing to follow. And he has lost all political capital. So for two reasons, I don't believe that he's fit to govern. One, he has lost all his leadership capability. And the other is that people have so many moral qualms about him that there's absolutely no trust between the governor and any of his constituents. So he functionally is not able to lead at this point, independent of whether he has a psychiatric diagnosis.
Well, I don't know too much about the psychiatric diagnosis, but in terms of the politics, this is some of the most bizarre, crazy political behavior I think I've ever seen, and for that reason, I'll agree with you. Dr. Larry Grimm and Dr. Danielle Schreier, thank you both so much for coming on. We appreciate it.
It's nice to be here.
From Psycho...